Welcome to our presentation of our capital project, BoldVision 2020. Our goal today is to share information about the project and the impact of the project on the community. This year we're celebrating 70 years of serving the Goldendale community. We wanted to take this time to walk through some historic photos from our beginnings. We found this photo of Goldendale's new hospital. It was the hospital that was in Dr. Collins' office from 1910 to 1920. Shortly thereafter, the community realized the importance of having a hospital and voted to form a public hospital district in 1946. KVH is still a public hospital district today. $26 million in net revenue, just under 5% of that is from tax-supported dollars. In 1947, community broke ground, and in 1949 built the first Hilberton Hospital. There's a rendition of the hospital and then its completion. The hospital was state-of-the-art, but quickly grew, and an additional 18 patient rooms and surgery room was added in 1967. In 1971, the community recruited Dr. Thompson and built a clinic for him. We're going to walk through the many additions that the hospital district has had over the years as our volumes and services offered has grown. So here's the original footprint of the hospital in 1949. In 1967, 11 patient rooms and a new operating room was added, among some other things. In 1971, Dr. Thompson, about half of this building was built. In 1985, there was a renovation of the ICU, ambulance bay, and generators. In 1998, the foundation built Golden View Assisted Living Terrace. It was purchased by KVH in 2007. In 2003, the hall from the hospital to the assisted living was built to connect the two. In 2005, the completion of the emergency department and radiology was done with the bond that was issued in the year 2000 of $7.5 million. It paid for the ED and radiology and the lower shell, as well as some infrastructure work. In 2006, the lab was remodeled where the prior emergency department was. In 2015, we remodeled first and half of the second floor of family medicine. The helipad was built with the support of the Memorial Foundation and the community. In 2016, home health, hospice, and the business office and accounting moved into the old clinic. In 2017, PT was remodeled, the space, the shell in the basement, and our wellness and therapy center was completed. 2018, we started a project for a behavioral health clinic to be added and to integrate primary care. Was with a legislative grant that we received. And our BoldVision 2020 project, we wanted to add right to the front of the hospital. Over the years, generous donations and grants have supported much of the work that has been done. We had the bond in 2000 that helped a major addition that was completed in 2005. But since then, we have about $5 million in outstanding debt with the remodel projects and the purchase of the assisted living. This is a rough rendering of the placement of our BoldVision 2020 project. Our helipad would remain in place, and we would connect this to the front part of the hospital. We would have the same registration area, but better access, improved parking. And this is the view from a patient's window. They'll have the second floor, great view of Mount Adams, and plenty of room for family and visitors. New operating room would have more space for new technology, staff, and infrastructure support. These are the expansion project priorities: the new patient wing and surgery unit, repurposing the current inpatient unit for long-term care, increasing specialty care and outpatient services, such as pharmacy, wound care, IV hydration, specialty care of more special surgical subspecialties, education and meeting space near expanded nutritional services facilities. You can see with all the additions that were done, we have utilized every inch of space on the campus that we have. We have nowhere to expand services, and we have a desire of the community to offer additional services. So we've been constantly condensing and moving departments around. We've had a little domino effect as we have remodeled one space and been able to move departments. We've pretty much filled up the campus. If we wanted to hire more specialists, we really wouldn't have the space to put them. The age of the facility has really reached its maximum life for purposes of acute care. In our acute care unit, we have shared bathrooms. They're dual occupancy. There's really not room for new technology and not much room for visitors. In our surgery area, there's specific environmental requirements and infrastructure limitations that we're not able to do more complicated surgeries that we would be capable of doing and have the orthopedic surgeons, other surgeons here to do. Our pharmacy is in a 128 square foot little room for 2 employees and all the medications and supplies. We don't have a hood to be able to mix medications, which limits some patients that we can keep here. Our parking lot is sloped and it does get a little dicey during inclement weather. We have generators that were surplused in 1967. They're from the 40s. And our nutritional services, our dietary program, is really designed for assisted living, a family style. We looked at the cost of remodeling the space versus new construction, found that it's really not cost effective. We looked at building a brand new hospital. That would be about $45 million. But we think that we can do this project and provide all the services that we currently provide and have a brand new hospital with expansion and utilize all the current space. So we've done an exceptional job of maintaining the facility, keeping it in top working condition. We're a community hospital. One of our core values is to be responsible stewards of our resources. But there is a lifespan for everything. Just like your car, if you've taken care of it well and regular maintenance and repairs, it will serve you well for many years. We've done that with the hospital. I'm very proud of how well we've maintained the hospital, but it's really time to replace that engine. So our vision is to provide the very best clinical outcomes and experience for our patients, and we just think that it's time to upgrade that facility. When receiving healthcare, you want to feel confident that you're getting the very best care you can. First impressions are important in establishing that confidence, and environment plays really an important role, whether it's curb appeal or the condition of the facility. We've done a lot of great things inside these 4 walls, but you don't always recognize that when you drive up in the parking lot. We also know that we're in a rural area and it's difficult to recruit providers and clinical staff, but we have found that if you have a nice environment and working space, that it helps recruit. So we found that when we remodeled the first and half of the second floor, family medicine, we recruited 3 physician assistants and 1 physician that summer. And I really believe the nice new space made a significant contribution to that versus the really dated and limited small space that they had in the medicine. So we just wanted to give you an example of kind of where we become limited. A patient comes in to the clinic and has some hip pain. Has that family medicine visit. He's referred to the orthopedic. We have a orthopedic surgeon and a podiatrist that come visit our facility. So they see them there. They have all the images they need. They realize that they need to have that total joint replacement, and that's where we really break down. We are not able to offer that because of the environmental controls in our surgery room. We do offer inpatient transitional care, so if you had that surgery here, you would stay on the inpatient unit, and if you needed a little bit longer, you could transition and stay in that same bed and have more continued PT, OT if necessary. You could be discharged home, and our home health program would continue to offer services. Once you're ready to start traveling, you could come into our new therapy center and continue your treatment. So we really started this process 5 years ago. We identified that we were running into some major space issues and age of the facility issues. So we needed to get serious about our future planning of the hospital district. We didn't want a gap in care of when we ran out of space and limited what we could provide. We've been growing pretty quickly, expanding with services. So we sat down with the architect and identified the areas, priorities of the acute care unit, surgical capabilities, pharmacy, dietary space, education, meeting space, our wellness and therapy center, and long-term care. I do want to point out that our wellness and therapy center, when we had therapy services provided in a smaller, different space, we were really limited on the services that we were providing. We had 1 full-time physical therapist. When we completed that space at the end of 2017, opened in December, in 1 year, we had 4 full-time physical therapists. So that program really just took off when we were able to provide the space and the clinical team to provide that care. We know that we have an aging population, and we know that people older than 65 are 4 times more likely to be hospitalized than those who are under 65. So there's going to be a growing need. If you've been in the community long, you know that long-term care is definitely a need. This was a study that was completed with the Department of Health through the Certificate of Need program. The projections you can see for Klickitat County in 2022, we will have a shortage of 180 long-term care beds. There's no long-term care beds in Klickitat County. Closest that we send people to are the Dalles, Toppenish, Hood River. It's not as convenient for the patient or for the family that they have to travel. After we completed the Wellness and Therapy Center in the end of 2017, we started this. We went back to our master facility process and we started our project development. We engaged several professionals to help us along the way, so we spent the first quarter of 2017 doing that. We hired a project manager, Dick Bratton, who has been in the industry for years and worked on several hospital projects, including Summit Pacific Medical Center in Elma, Washington, and Jefferson Hospital in Port Townsend. He's very, very knowledgeable. We went through the RFP process to hire an architect, and we had over 10 responses, and we were able to narrow that down to 4 who we interviewed. And we ended up ultimately selecting Malem. We really felt like Malem saw our vision for promoting health and wellness in a rural community. And we also found an underwriter, Jeff Fivecoat with Piper Jaffray has been a great advisor as we've looked at financing options and costs. The next quarter we spent looking at the market data and the space needs. So we engaged Jody Corona with the Health Facilities Planning Organization to really help us do that. We wanted to know with our current market data and our market capture, what we're currently serving, what would our space needs do? And that just confirmed that we do need 7 to 8 inpatient beds. We need 3 or 4 OR rooms, and we need treatment space for outpatient services for wound care and infusion. So that really helped support it. We have the data to support without what our plans were. In the next phase of the project, we sat down with the architect and we developed a concept. We looked at where on the campus we would like to locate this new project, and we were able to identify that and how much square footage that would take. We went through and apply for an alternative building process, and we did that, and we were approved. So what that means for us is that we were able to hire a general contractor before the plans are designed. So it's really more of a design build than a design bid build process. The data shows that if you have the general contractor involved in the development of the construction documents, change orders are minimized. So you can have significant savings up to 3 to 5% of the total project cost, which on a $15 million project is pretty good and significant. The next quarter, we went to the community and said, okay, we think we know what we need. The market data supports it, but we want to make sure, public hospital district, we want to make sure that we're doing what the community wants us to do. So we had some community surveys done. We had several community meetings and got input. We took all that data and we confirmed what we believe to be true. The greatest need for the community was access and convenience. Really, they want to be able to receive services locally. And we found that when we opened the Wellness and Therapy Center, our community started to really get their services here because it was available. And we found that in primary care data, and then again in the survey, over 70% of our community receives their primary care here. Of those surveyed, 85% who needed to go to an emergency room went to our emergency room. So we do have that community support, and with more services being offered here, if they're quality services, I'm confident the community will support us. So we're doing what the community wants us to do with this project. So once we got that confirmation, we engaged Dingus Aracor and Associates to do a feasibility study. We took our 2018 financial information, our 2019 budget, and then projected out 5 years, taking into consideration the 15 long-term care beds and the construction costs and then the debt service on that going forward to see if that was going to be feasible. And it came back to say, yes, it is feasible from a financial statement perspective, income statement. It will work. However, it confirmed what we knew, which is we didn't have the cash flow to service the debt on this project. It's about $1.3 million per year in debt service. And so we really need the support of the community to be able to continue this process. So in March, the board approved a resolution to go to the community and ask support. for support through a bond TIF. So the new wing will be 2 floors, 24,000 square feet. The first floor will be hospital pharmacy to provide some outpatient pharmacy services, nutrition services, community education and meeting space, and a small volunteer gift shop. Our volunteers have done a great job at the hospital. We love having them, and they would like to have a little gift shop in conjunction with the foundation. On the second floor, we'd have our surgical suites and our care and transitional care inpatient unit. We want to repurpose our existing space. So as I mentioned previously, we want to take our current acute care unit and make that a long-term care unit. We have a license for 25 beds as a critical access hospital. Those beds can swing between inpatient or long-term care. So we want to leave 10 beds available for acute, and that leaves 15 beds available for long-term care. We do have room in that unit to be able to provide that service, which is much needed for our community. Our current surgery area, we would convert into outpatient services. So we would be able to provide more medication infusions, blood transfusions, wound care, and a respiratory therapy program would be moved there. And nutrition services, we would move some of the folks who are on the third floor of the family medicine building into that space as office space so that we can continue to grow our specialty and primary care services that are offered in that building. This is how the square footage would be broken down. And these are based upon, the architects have benchmarking information on surgical services. When you have 3 procedure rooms, this is about the square footage that it takes. Same with when you have 8 acute care rooms. We would have 6 private rooms and 2 semi-private rooms for a total of a capacity of 10. Our pharmacy space, we, as I mentioned, only have 128 square feet for pharmacy right now. We don't have a hood to mix. So we do want to start to offer some pharmacy services dispensing to our patients that we see in the emergency department and they get discharged from the hospital, or maybe they're seen in our express care and our local pharmacy isn't open. We want to be able to make sure that our patients have the medications that they need to help them get better as part of their care. We'll have that small gift shop for the volunteers and foundation, an education center, which really a flex space, meeting rooms, education. We're excited. We just recently signed on with Columbia Gorge Community College grant application with the USDA, and hopefully we can start offering some CNA classes and maybe other healthcare classes through Columbia Gorge Community College and maybe in conjunction also with the high school for credit for our students as they go into healthcare career paths. We'll have to replace some of the front of the hospital that is administration space, registration space, and then our nutrition, dietary services, and cafeteria. It's kind of a breakdown of what we see that 24,000 square feet being. The project budget, construction of just about $14.5 million. There is a 3% contractors contingency built into that. We have professional services with engineers, architects, furniture and equipment for this new space, often pretty expensive. The other contingency is another 7%. So in total, we have 10% contingency built into the project. And then the interest and financing costs of the project, other costs, so just under $20 million. So this equates to about $570 per square foot. So we wanted to see how this compared to some similar projects. Some of these are not hospital projects, so you can see the lower cost per square footage, but some of them are. When we look at Prosser's acute care and surgery unit, and then you take the year that it was completed and put that into 2020 numbers to make that comparison, and you can see that we're actually even lower than those. The reason that we're a little bit lower is because we have the first floor that offsets the cost of the second floor. The first floor is not patient care primarily related, where 2 most expensive things you can do in a hospital, surgery and acute care units on that second floor. So the 2 together really kind of help offset the total cost. So how will it impact you as a property tax owner? So our current bond, which was issued in the year 2000, was approved and it began at $1.29 per thousand. Currently, that's at 43 cents per thousand due to the increased property values in the hospital district. The new bond will be about $1. It could go down to 40 cents per thousand, assuming a 1% new construction growth for the hospital district service area over that 25 years. As the assessed value of the district grows, the amount paid decreases. So on a $200,000 assessed property, you're currently paying for the bond portion of your property tax. The hospital district is $86. The new bond payment would be $204, so you'd have a difference of $118 or a little less than $10 a month. How will the bond impact our community? Well, we were able to get this information off of the National Center for Rural Health Works that has a critical access hospital model for economic impact. So currently in 2019, with our projected budget, we have 208 FTEs. That creates a secondary jobs in our community of 71 jobs. This construction project, a $15 million construction project, creates about 135 jobs with a secondary impact of 25 jobs in the community. And a finished project, we would have 230 jobs and additional 78 in the community. The economic impact to the community, the economic impact is about 26 million in the community. The construction will be just over 7.5 million. Our finished project will be almost 28.5 million. So we'll create 22 new permanent jobs at the hospital with another 7 secondary job impacts, so for a total of 29, and another over $2 million of economic value in the community. What are our next steps? Hopefully, we'll have bond approval in August. If we do receive that approval, we will go forward with interim financing with bond anticipation notes and start that design process. Why interim financing? Well, inflation rates increased in 2019 at 4.62%, and that's kind of been the trend the last couple of years. So we took into consideration inflation rates and came up with, if the project inflation is between 3% to 5%, we could save net of finance costs between $600,000 to $1 million by jumpstarting this project 15 months early. So if we can start this project, the design process takes about 15 months to get the construction documents and engineers and everybody to get the documents completed. That would be done. And then in January of 2021, construction would begin, and that's another 15-month process. And then construction would be finished in March of 2022. This is what the bond proposition will look like on the ballot. The ballots will be mailed no earlier than July 17th and no later than July 19th. They have to be submitted by August 6th. That's when the voting day is. So this is the language that you'll see on the ballot proposition. We would be happy to answer any additional questions you have regarding this project or any other questions about the hospital district. We'll be presenting at various meetings and different locations in June and July, so you're welcome to look for those or call and find out a date. We'll be having an open house in July as well to meet with the architect and the project manager, or you can email us at admin@kvhealth.net and we can provide more information that way as well. You're always welcome to come in or call, and we'll see if we can answer your question. Thank you for listening to the presentation.